Rosa Parks, Ronald Reagan, and Jimmy Stewart. You've probably heard of all of them from their activism, their politics, and their acting. However, did you know that they all died from the same brain disease? You've probably heard of this one. It's called Alzheimer's disease. We're good.
Right. Do you know what Alzheimer's disease is?
Kinda. I think it's when you start to lose some of your basic memories that you've had before, like such as like maybe who an old friend is. Yeah, like a disease that is like harmful for people's minds, where like they can't remember things.
It's a disease that makes you forget things that meant something to you in your life at one point.
Alzheimer's disease, more commonly known as Alzheimer's, is a neurodegenerative disease that causes problems with your memory, behavior, and thinking. It is a type of dementia, a group of conditions identified by the impairment of multiple brain functions, such as behavioral changes and memory loss. Alzheimer's is, by far, the most common form of dementia. Currently, nearly 5.5 million Americans are affected by this disease. Alzheimer's is progressive, meaning it gradually worsens as one ages. While the majority of those affected by Alzheimer's are over the age of 65, approximately 200,000 Americans under the age of 65 are affected as well. This condition is called early onset Alzheimer's, which is most commonly diagnosed during ages 40 to 50. Alzheimer's disease is most commonly marked by memory loss and confusion with time and place. For example, someone with Alzheimer's may misplace their keys more often than others, or will briefly forget where they are. Other common symptoms are drastic changes in mood and personality. A person with Alzheimer's may have been outgoing before, but now chooses to avoid social situations and activities.
If you think that you're experiencing any of these symptoms, you should visit a doctor or a medical professional if you're curious about a diagnosis. Although there is no one test to confirm or deny Alzheimer's, there are a series of tests that doctors can give to see if you have the disease. These are reflexes, coordination, strength, eye movement, speech, and sensation. Doctors can also look at brain imaging to see if there are any abnormalities in the brain. Now, Alzheimer's has been connected to genetics, and a family history is usually a good way to give doctors a good inference as to whether or not you have the disease. And these symptoms, it's important to stress, do not mean Alzheimer's. While a lot of these symptoms are common in Alzheimer's patients, they can also be accounted for by puberty and stress in people at your age. And early onset Alzheimer's does not appear until around 40 or 50. Even though it's incredibly unlikely that you will have Alzheimer's at your age, there are many things that you can do to avoid getting the disease later on in your life. You can prevent Alzheimer's by exercising, participating in social activities, eating a good and healthy diet, getting long and quality sleep, and participating in stress management activities like yoga.
Do you know anyone with Alzheimer's disease?
No, I don't.
Well, what do you think it would be like to know someone like that?
I think it'd be pretty tough, especially if it was somebody you're related to maybe like see them every week or so and have to remind them who you are. That'd be pretty brutal to go through. My step-grandmother has Alzheimer's disease.
And what was your experience with her?
I went to the zoo over the summer with her, and like she doesn't really remember who like me and my sister are when we go do that. And like we have to like be careful, like make sure we're following around. She forgot like how to use the water fountain, so we had to like show her and like help her use that. So it's just like you have to take some extra care, but you can still definitely have like meaningful interaction with people who have Alzheimer's.
My grandma had dementia, which is similar to Alzheimer's.
And what was your experience with that?
It was really hard, especially for my dad, and like seeing someone go through that and like slowly forget who you are, kind of. And I didn't really see her when she was in a bad state, but my dad did, and it was really hard on him.
There are 3 main stages of Alzheimer's disease: mild, moderate, and severe. In the mild, or early stage of Alzheimer's, most people can function on their own and are capable of working, driving, and participating in social activities. However, they do begin to have lapses in memory and decision-making. It is usually during this time when friends and family begin to notice the symptoms of Alzheimer's disease. The moderate or middle stage is typically the longest of the 3 stages. Here the disease progresses and the person affected begins to require extra care. During this stage, people can have trouble performing routine tasks and recalling personal information. It is during this stage that behavioral changes emerge, such as increased frustration. During the severe or late stage, people require close care as their disease worsens. It becomes hard to express one's feelings and carry conversations in this stage. People also may lose their ability to respond to their surroundings and perform standard activities like walking and swallowing. While Alzheimer's disease does cause major brain deterioration, it is most often secondary illnesses and conditions like organ failure or heart attacks that cause death.
While scientists do not know the exact cause of Alzheimer's disease, they do know that it is a neurodegenerative disease characterized by its progressive brain cell death and shrinkage of the brain. Scientists have studied the brains of Alzheimer's patients and discovered 2 main hallmarks of the disease: plaques and tangles. Plaques are clumps of the protein beta amyloid. They are thought to interfere with cell-to-cell communication. Tangles are made up of the tau proteins. Tau proteins help carry essential nutrients to the brain cells. Tangles are defined as tau proteins that have failed to carry nutrients to the brain cells. This causes the brain cells to die. Scientists have characterized these 2 abnormalities as the main causes of Alzheimer's. Alzheimer's disease was discovered in 1906 when patient Auguste D. went to her doctor, Alois Alzheimer, because she was having issues with memory and language. Alzheimer's was unable to diagnose her with anything and unable to treat her. And when she died, he took an autopsy of her brain and discovered these very same plaques and tangles. 4 years ago, a neighbor who is very dear to me was diagnosed with Alzheimer's. More and more, I will realize that as we're having conversations, she will loop back around to the start of the conversation to tell me things that she's already forgotten she's told me. It all raises the question in my mind, when will I have to reintroduce myself to her?
And what do you think it would feel like if you had it yourself?
It would probably be kind of stressful, and I bet they feel bad about what is going on, but they can't really do anything about it.
It would be kind of, I want to say frustrating, because if people are telling you, or if like you're informed that you have this disease or something, and you know that there's nothing really you can do about it, then it would definitely be kind of frustrating.
So?
It'd be pretty discouraging having to, especially if you couldn't remember who your grandkids were, even your own children. It would be pretty difficult going through that every day.